pathology question. A 55-year-old man presented with dyspepsia. Okay? Upper GI endoscopy showed an irregular and erythematous area protrude proximally from gastroesophageal junction. Okay? Apart from a specialized intestinal metaplasia, which of the following cells should also be present diagnosed with Barrett's esophagus? So you're having a patient with a diagnosis of Barrett's esophagus, and they're basically asking you what kind of epithelium does Barrett's esophagus has, and consequently what type of cell that is present in Barrett's esophagus. So basically, let's talk about Barrett's esophagus. What is the natural history for Barrett's esophagus? So basically, you will be having a man, mostly a man, who is a smoker and obese, and presented to you about a very long history of dyspepsia, okay, and burning sensation on the back of the sternum for so long time, okay. So those patients mostly having gastroesophageal reflux disease for so long time, and then due to presence of the acid inside the lower part of the esophagus, the lower esophagus, this will lead to a change in the epithelium of the esophagus. And this change in the epithelium, we call it metaplasia. Metaplasia, it means a change in the epithelium. So what is the esophageal epithelium? It is basically a squamous epithelium. And what is a change? The change will be columnar epithelium, because it's coming from the stomach. Columnar epithelium contains basically goblet cells. So the answer to the question will be this: goblet cells, okay? Because they're asking you, the patient had metaplasia and developed Barrett's esophagus, what confirmed the diagnosis? And here brings to another question, which is, how to diagnose Barrett's esophagus? How to diagnose Barrett's esophagus? The most confirmatory diagnosis is by doing two things. Okay? Two things. Number one is endoscopy. From the clinical finding, you'll find something on the lower end of the esophagus that is mostly irregular, and thirdly, erythematous. On the other side, I will take a biopsy from this, and you will find metaplasia, okay, which means a change in epithelium, and goblet cells will confirm your diagnosis. This is how to diagnose. So what to do next if you diagnose the patient with Barrett's esophagus? How will you treat them, or what will be your plan? So number one, we need to relieve the symptoms by giving proton pump inhibitors. Number two, we need to ask them, it changed your life, okay? Meaning, number one, quit smoking. Number two, stop being fat, meaning lose weight. Stop eating chocolate. Stop eating heavy meals. Stop eating before sleep. Raise the end of the bed. Stop wearing tight clothes. And finally, take your medication, which is proton pump inhibitor. Number three is you need to follow up these patients. Every 2 or 3 years, you will need to do an endoscopy again to exclude one of the most important things that we're going to mention. After putting the patient on follow-up, which is surveillance, okay? Sometimes they say from 2 to 5 years, not 2 to 3 years, okay? So when you do this, you are managing the Barrett's esophagus pretty well. However, you will need to know that Barrett's esophagus is a sequential process, meaning it starts with normal epithelium with only some symptoms, then it changes to metaplasia, which is columnar epithelium, and then move to dysplasia, appearance of some malignant cells, and then malignancy, which is carcinoma. They say that 40% of the patients under this surveillance develop cancer after 3 years. So it's pretty important to know about Barrett's esophagus. Thank you very much.